look at Nigeria, we're at the moment suffering from triple burden of diseases. These are infectious diseases, non-communicable diseases, and injuries. Example of an infectious disease is malaria. A lot of us think malaria is like getting the flu, but it's a really serious disease. It kills 500,000 people every year. Most of them are children under the ages of 5 and pregnant women. Malaria kills more people than Boko Haram. Cancer and diabetes are lifestyle diseases which are non-communicable. And as you can see, Nigeria started to get a really high incidence of cancers. And a lot of us thought, okay, well, we weren't getting this disease in like the 80s or 70s or 60s. Perhaps reporting wasn't there. But a lot of our older parents and even young children are getting childhood cancers. And injuries like roadside injuries, like accidents and stuff, also affect the nation. Unfortunately, our health system at the moment is overburdened. We do not have enough facilities or even enough doctors to go around. Healthcare at the moment, apart from it being overburdened, access is not equitable. So we do have an inequitable access to healthcare in all areas. So, for example, a lot of people pay out-of-pocket payments. So you go to a hospital and you pay for your own treatment. A lot of people can't afford that because it's really costly. Then you have people who live in the rural areas where access to healthcare is actually a problem because, for example, if say you live in the north, to get to a health facility, it could take you up to 2 hours because, again, it's really sparsely then populated. And then the roads, a lot of the roads are bad, and that increases journey time. And I will tell you that some of these factors contribute to maternal mortality. I'm sure you have heard that Nigeria has the worst one of the worst maternal mortalities in the world. So being born in Nigeria is actually already terrible. So if you have money, for example, and say, okay, money's not your problem, I can afford healthcare, the cost is a problem. But then also the quality of healthcare you get is actually not up to par for the sort of money that you're paying for it. So this is actually shown by things like negligence or misdiagnosis, which I'm sure a lot of people can actually relate to. And all of these things cause morbidity and eventually death. And if you have a lot of money, then you can travel abroad and pay for healthcare, which a lot of rich people do. Unfortunately, 30,000 Nigerians spent up to $1 billion last year on medical tourism. This, of course, is not really healthy for a young economy like ours. Now, I grew up in Nigeria, and my first experience with a terrible healthcare system happened when I was 7 years old. I remember I was 7 years old because I had malaria, and I was actually in the hospital with my best friend who also had malaria. And unfortunately, my best friend died of malaria infection because the parasites got into her brain. The doctors were giving her chloroquine. They kept on increasing the dosage, but she wasn't getting better. But they kept on doing it because that's what they knew how to do. And then she lost her life. Now, it's not the doctor's fault because he was a victim of his circumstance, right? Didn't know that chloroquine wasn't working anymore. Now, investing in healthcare is not just about buying MRI machines or buying CT scans. It's investing in the people, the health professionals. Science research and development is important. If we do not invest in science research and development, then the quality of healthcare we're going to get is going to be subpar. Your doctors can't know that there's drug resistance going on here because there's no money to do research. Research costs money, right? When you go abroad, you're getting really good healthcare because most of these people are constantly educating themselves. There's research, and that feeds back into the quality of healthcare that you get. Now, unfortunately, Nigeria was not always like that. I mean, today you get doctors working in like terrible conditions. There's no light to carry out surgery. You put on generators for surgical operations, or you're waiting for your salary and you're on strike every other month. This is not how a healthcare system should actually function. It wasn't always like that. Around the 70s, early 70s, the Obafemi Awolowo University was actually one of the universities where the United Kingdom's NHS poached doctors from. So majority of the doctors in the UK at the time came from OAU. It was that good. Nigerian doctors are really smart. Unfortunately, you are obviously a victim of circumstance half the time. But now, that hospital cannot even boast of a functional MRI machine or a scan. And some hospitals that even have it do not have the skills. We don't have maintenance culture. You have machines, you go to a hospital, they say, it's not working anymore, or this person isn't around to do this or that. We don't have the skills to run these things, and it shouldn't be like this. Now, Let's talk about other countries. How is it that Nigeria measures up with our neighbors? Nigerians like to compare to Ghana. I say Ghana jollof rice and Nigerian jollof rice. Perhaps that's the only thing they would think better. Nigerians aren't doing so well when it comes to healthcare compared to Ghana. The average life expectancy in Ghana is 62 years old. In Nigeria today, it's 53 years old, which means that you're born today, you're going to at least live till you're 53. So you have a better chance of survival if you live in Ghana than Nigeria. Rwanda has a high expectancy of 67 years old. Now, let me put this into context a little bit. Rwanda had a civil war in 1994. Now, civil war causes destabilization in the health system, which means that you can even die from little things like diarrhea. Now, Rwanda is doing way better than Nigeria in so many indicators. For example, its child mortality has been reduced by half. Under 5 mortality has been reduced by half. Rwanda has reduced 2/3 of malaria infections in their country. 94% of Rwandans have health insurance. They're covered by health insurance, which means that the poorest parts, the poorest people in their society, the poorest members can actually go to the hospital and get free treatment. It's a social security situation. Nigeria, we have the highest malaria infection. According to World Malaria Report in 2017, we're suffering more malaria than any other African country, right? Maternal mortality is very high. You heard Mr. Bill Gates say that. Child mortality is absolutely high. And 6% of our population has health insurance. And I promise you, it's not obviously social, it's private health insurance. So these are the problems we're looking at. And how can we go from being a country that has all of these problems to solving our problems? It's not just focusing on health care in terms of medical services and medicines. We need to take it a little bit further with like talking about health investment in research. Again, without research, we can't. Malaria is one of the things killing most of us in Nigeria. But we don't have a lot of scientists doing local research. We wait for America to bring medicines to treat our people. We have a lot of local herbs. When I was young, my grandma used to drink something, and I don't really know what it is, but it cured malaria. How come no one is actually doing that research? So the government needs to focus on investing in the health professionals as well as the healthcare system, because health investment is not just about saving lives, it has greater, wider economic impact as well. Thank you.